Good evening. I'm Mayor Ron Nirenberg with Bexar County Commissioner Justin Rodriguez, and we're joined tonight by Assistant Director of Metro Health, Dr. Anita Kurian. This is our COVID-19 update for the San Antonio community. Today we're reporting 734 new cases of COVID-19. Our 7-day moving average has gone down and is now 808. We are unfortunately reporting 13 new deaths due to COVID this evening. We've lost a total of 4,162 people in our community to this virus. And remember, these are loved ones. They're not numbers. They're fathers and sons, mothers and daughters, loved ones, lives well lived and now lost. So please keep them and their families in your prayers this evening. In our hospitals, there are 960 patients in local area hospitals. We are thankful that number is below 1,000 now for a few days. There were 114 new admissions in the last 24 hours. That is our low number for quite some time. 330 patients are in the ICU this evening with COVID, and 212 are on ventilators. 84 patients in area hospitals are unvaccinated. 22 patients are children as of today. At this time, in terms of our vaccination rates, almost 1.2 million Bexar County residents are fully vaccinated, and 1.4 million have received at least one dose. As a reminder, Metro Health will be launching a vaccine incentive very soon. The people eligible to receive an incentive of a $100 H-E-B gift card are those receiving the one-dose Johnson & Johnson vaccine or the second dose of the Pfizer or Moderna vaccinations. And this incentive will only be available at Metro Health vaccine clinics, and the gift cards will be available until supplies last. So stay tuned for that. We'll have an update next week on when that will be rolling out, and that will be very soon. So let me now turn it over to Commissioner Rodriguez.
Great. Thank you, Mayor. And good numbers. They're looking better, at least. I know that everybody's committed to making sure that we're masking up, and those that aren't vaccinated, getting vaccinated. In addition, there's going to be some news coming out tomorrow. I know the FDA is going to be meeting with a potential recommendation to the CDC on a booster. We don't have any information yet on when those will be available, but stay tuned. I think starting next week, there's a possibility, particularly those who were in line at the beginning back in December that got vaccinated, that the booster will be available starting hopefully as soon as next week. In terms of the numbers, I wanted to just point out and give just a quick shout out to those that are working over at Freeman, the Regional Infusion Center, where we think certainly there's a relationship to the folks that are getting treated over there and hopefully the dip in the number of hospitalizations. Another 94 folks got the antibody infusion treatment there today, averaging about 100 a day. So again, we want to just thank all of our first responders, those that are responding to this community pandemic, those that are on the front lines. And again, I think overall, we're all responding in a certain way because we're heeding the advice of those public health professionals that are telling us what to do, and that is, of course, keeping distance, masking up, and getting vaccinated if you have not gotten vaccinated. So please do that. Plenty of opportunity to, and let's just keep it up. So thank you, Mayor.
Great. Thank you very much, Commissioner. I want to remind you, part of our success here in containing this virus is the testing of folks who have symptoms. So if you need a testing location or a vaccination clinic, please visit covid19.sanantonio.gov. You can also call the COVID-19 hotline by dialing 311 and hitting option 8. Please, in the meantime, continue wearing a mask and get vaccinated. And I also want to alert you to the other emergency that's going on, and that is with our blood supply. Please consider making a donation of blood to help our South Texas Blood and Tissue Center keep up with the demand. We know we are at a critical shortage of blood supplies of all types, particularly type O, which is used in trauma. So if you can, please schedule an appointment with University Health or go to southtexasblood.org. In the meantime, thank you so much for everyone who is doing their part to contain this virus and protect themselves and their loved ones. Continue wearing a mask and get vaccinated. And if you know someone who is eligible and has not received one, please encourage them to do the right thing and get vaccinated. Do it for you, do it for your family, and do it for San Antonio. To get the latest on COVID-19 in our community, text COSA-GOV to 55000 or by go to the website covid19.sanantonio.gov. With that, Dr. Kurian, Commissioner Rodriguez, and myself are available for questions.
There's an electronic billboard up in San Antonio that is sharing an anti-vaccine message. it says don't be bullied with the coronavirus vaccine vial. Could you give us your thoughts on this and tell us what message you might have for the people who are behind this ad?
Well, this is certainly raises questions when a organization out of Minnesota has interest in buying San Antonio billboards. Clearly, they have a political agenda. I looked up the organization. Apparently, they're anti-vax, anti-mask, anti-public health. So go do the calculation and figure if you want to listen to that message or to your doctor.
Yeah, and I would just say, we've got smart people here in our community. Use your common sense. The numbers aren't lying. 85 to 90% of those that have been hospitalized have been unvaccinated. So, we can't let those kind of things detract us from our goal. We are, I think, singularly on a mission to defeat this pandemic, defeat COVID, and we know the way to do that is to get vaccinated. So we're not going to let anybody distract us from that mission.
What message would you have for people who feel they are being bullied by pro-COVID vaccine efforts?
People who are feeling bullied by pro-COVID, so people.
Bullied by the pro-vaccine people.
I haven't met anybody who said that. If they feel that way, I'd love to visit about that because what you're hearing in terms of people encouraging others to get vaccinated is to protect the health of the person and the people around them, which unfortunately, if people need convincing about that, demonstrates why we need to have that message loudly and regularly.
Yeah, and unfortunately, there's disinformation out there, and there's pressure from those social media type groups and discussion groups. The reality is the reality, and we know that we need to get folks vaccinated. We need shots in arms to defeat this. So again, we just can't let folks bully other people into doing something that shouldn't be done for the good of the public health, right? I mean, we know the numbers aren't lying, and again, I think our message to the bullies is, sometimes you got to punch a bully in the face, but at this point, the way to do that by punching back is by getting a vaccination.
Dr. Kurian, can you talk a little about, Commissioner Rodriguez talked about the infusion center. Can you talk about why that might be needed? Is that after you get a positive test result, or do you need a doctor's prescription for that?
So the monoclonal antibody therapeutics are recommended for folks who are mildly ill. So definitely you need to have a positive COVID test, and the treatment starts once your provider makes the referral.
Laura, do you have any more? Thank you. That's all we have tonight.
Thank you.